Hi everyone, I'm John Hammerly with the Plastic Surgery Channel. Today's option and subject is something that, fortunately, my two friends here tell me I don't have. Hollow tear trough. What do you do to fix it?
Well, it's really about blending. I think that people look for catchphrases, but what we want to be able to do is create kind of that smooth transition. We like kind of a gentle arc and curve in that area, and that's what makes us feel like something is young. And so that's what we try and restore. And that's really my takeaway when I'm treating that area, whether it's surgery or non-surgery. What do you think, Anup?
I think that when you try to restore youthfulness to the eyelids, you're trying to eradicate the tear trough area where the cheek meets the eyelid. And people who are youthful don't have the two distinct areas between an eyelid and a cheek. So that's kind of where we have different adjuncts, I think, to use, such as fillers and eyelid surgery.
Yeah, I think that's the...
Steve, let me interrupt you.
Go ahead.
Let's do basic hollow tear trough 101. Show on me what we're talking about, and maybe I don't have it, but what is a tear trough and what would be considered hollow?
Yeah. So I think hollow, you could say the word nursing home eyes and people kind of have a feeling about it. And just looking at your face right here, it's actually this junction right to the edge of the nose that kind of caves in. That's the tear trough. So imagine a tear coming out and then being caught in a small groove. On top of that, there's other things that bother people about their eyes, sometimes bags. So bags can be superimposed on top of a tear trough. And I think what Anup was saying, which was really, really, really important, is it's the idea that you're trying to combine these areas so there's smoothness, right? And so we're trying to blend the area in, we're trying to eradicate the tear trough. We have to fill it in with something and re-drape things. What we're trying to do is work on several different things. The tear trough happens because we talk about getting older and the face falls. So the tear trough basically is always there, but as our face descends, now we have a longer area of our lower eyelids. So we want to shorten that distance, right?
That's exactly right.
Who's a typical patient?
A typical patient is probably someone who's in their 50s that have come in, they want some rejuvenation. They start seeing that their eyes, or people comment that they look tired, they don't look crisp in the morning. So what you do when you evaluate that is what Steve highlighted, that you don't just look at the tear trough deformity, that deformity that we defined as the distinction between the eyelid and the cheek, but you have to look at the skin. Does the person have fat bulging through their eyelids? And then we have all kinds of tools in plastic surgery to try to treat that. Sometimes fillers, and Steve, you probably can comment a little bit more, that fillers aren't enough and people aren't candidates just for fillers.
Right. So the tear trough by itself is a catchphrase, and it is something that you see, so it's tempting to take a groove and fill it. That makes logical sense. What we do know is when you overdo an area like that, it's a sensitive area, you can have lots of problems, lots of complications. In fact, I think you see more complications from filling tear troughs than surgery to tear troughs. Things like blindness have happened, things like skin loss have happened, but the most common thing is an unfavorable wormy bulge that persists because the skin is so thin and fragile. What do you think? Yeah,
I think those are the common problems with fillers. People try to force it, too much filler, they become clumpy, there's not enough, the skin isn't smooth. So when you do surgery, you have much more control over that.
This is the place to come to. You've already figured it out because you're here, but tell your friends to come to theplasticsurgerychannel.com.